Senior Resident, Department of General Medicine, will be delivering a talk on the latest in dengue and mainly the awareness. In fact, all of you may be aware that a lot of things can be done to prevent the spread of dengue, and even so all those preventive aspects will be covered in the talk, and latest aspects about dengue will be covered. So I would request Dr. Shin to take over.
Good afternoon, everyone. As we all know, today is the National Dengue Day or Dengue Prevention Day, which is being notified every year on May 16th. So, as Sir told, today's this DECA theme this year is Harness Partnership for Dengue Prevention or to defeat dengue. So, today we'll have a short discussion regarding dengue so that we'll be aware of this disease which is globally becoming a pandemic, exponentially rising also in these years as Mangalore is expecting monsoon in the near future. So let's just look at the world data regarding dengue. So it is being notified that 40% of the world population is being infected with dengue population at a risk of developing dengue infection, and 390 million people is already infected with dengue in worldwide. So recent notification says that the global rise in dengue is rising exponentially by 400%. So these factors are little alarming for us, and we should take a notification like not on these aspects of dengue. So main things that they consider because why this exponential rise of dengue in the near future of last 13 years is because of these few factors like high population density, rural to urban migration, degraded urban environment, absence of reliable pipe water supply, and inadequately funded mosquito control programs. So all these factors are adding up to this exponential rise in dengue in the near future or the last 13 years. So it is not about the mortality of dengue that is being concerning here. It is the economic and resource burden that this infection put on the health sector, which is being the problem with dengue infection. So, as we all know, dengue is an arboviral infection. Arbovirus means it is infecting the human by a vector or an agent. So, in case of dengue, it is transmitted by mosquito belonging to genus Aedes, and specifically the vector is Aedes aegypti. And the virus, dengue virus, is a flavivirus, and it is transmitted by this mosquito on daytime and also nighttime or towards the evening. So this mosquito is a diurnal mosquito. So, and also it breeds on fresh water. So fresh stagnant water is the breeding point of these mosquitoes. So mainly this infection of dengue is seen in tropic and subtropic region, and in Asia it accounts for more than 75% of cases. So that's why India is one of the endemic zones for dengue, and moreover in Mangalore also. So followed by Asia, it is Latin America and Africa, which are more endemic to dengue. And transmission, as already told, it is through the bite of the mosquito, but there are some non-vector transmission process for dengue also, but it is very rare, mainly through blood transfusion, organ transplantation, needle stick injury, vertical transmission from mother to child, and also even through semen. So, but all this non-vector transmission is very rare, and mainly it is through the bite of infected mosquito. And these mosquito, once get infected, can bite more than one people, or more than one person can get infected through the bite of this female Aedes aegypti mosquito. So next, going to the clinical features. So clinical features are mainly categorized into three phases, mainly the febrile phase, critical phase, and recovery phase. So as the name suggests, all these phases, in these three phases, the critical phase is very important. So generally the incubation period for dengue is 4 to 7 days with a maximum of 14 days. So the febrile phase, as we all know, during this phase the patient will be having high-grade fever with chills, and they will have a saddleback pattern of fever. Saddleback pattern is nothing but, as we all know, the horse will have a saddle that it will be elevated and depressed. So the fever will be high at one point of time and later it regresses to normal, then it again picks up. So that is what the saddleback pattern, and usually the febrile phase lasts for 3 to 7 days of illness. And associated with fever in febrile phase, there will be associated other clinical manifestations like headache, malaise, that is extreme tiredness, retroorbital pain, and arthralgia, that is joint pain, and myalgia, that is muscle ache, bone pain, and nausea, vomiting. Because of the extreme arthralgia in dengue, there is also known as break-bone fever, and even the tourniquet test will be positive in this phase of dengue. Tourniquet test is also known as Hess test. It is nothing but when we inflate the sphygmomanometer between the systolic and diastolic blood pressure, there will be more petechiae, more than 10 to 20 petechiae in the 1 square centimeter is said to be positive for tourniquet test. So that will be positive during the febrile phase. Next phase is the critical phase. As the phase says, it is one of the critical point at which the patient care is required. So as a general saying goes, once the fever is subsided, the illness is said to be better. But in this case of dengue, once the fever subsides, it is more alarming that we should give more care to the patient because the patient is going for a critical phase. It is not like all these patients will pass through all these phases. Some patients may skip some phases, so it is the point to be noted. So critical phase will have many issues, as the name says. So one of it is a vascular leak syndrome. As it denotes, vascular leak syndrome is nothing but there will be detectable plasma leakage which will be occurring during the 4 to 6 days of illness. So during the 4 to 6 days, there will be patients' plasma will leak through the capillary and will get accumulated in the extravascular tissue. So which will result in intravascular volume diffusion. So the patient will have hypotension and also serosal effusion. Nothing but the patient will have pleural effusion, ascites, pericardial effusion and all. And also hyperproteinemia. Hyperproteinemia is because the intravascular component is moving out of the vasculature to the extravascular tissue. So there will be patient will be having hypoproteinemia. And if this leakage or the vascular leak syndrome is very severe, it will lead to dengue shock syndrome. Okay, dengue shock syndrome is one of the emergency situation in dengue management. So in severe leakage syndrome, it will lead to dengue shock syndrome. And during this phase of critical phase, there will be some warning signs which has to be looked into the patient. If the patient is having persistent vomiting, severe abdominal pain, or the patient is having any tender hepatomegaly, that liver is enlarged and it's tender, and if there is any serosal effusions like ascites, pleural effusion, pericardial effusion, if anything is there, if the patient is having mucosal bleeding, there is bleeding from the gums when the patient is brushing, or the patient while cannulating has excessive bleeding from the site, lethargy or restlessness, all these factors are putting towards a warning sign that the patient is going for severe dengue or dengue shock or dengue hemorrhagic fever. So if the patient comes with the dengue, if the patient is having all these warning signs, you have to be alert. And usually this critical phase will resolve by 48 to 72 hours. And another manifestation that can be seen in critical phase is bleeding. So as I told, there will be bleeding manifestation of skin petechiae, ecchymosis, and epistaxis, and gingival and GI bleeding, which can be seen. And most commonly it is mucosal bleeding. That is when the patient brushes, the patient will say the bleeding from the gums is happening. So that is the most common complaint the patient will say. And even some rare cases of intracranial hemorrhage has also been reported, but this intracranial hemorrhage is very fatal for the patient. And CNS involvement is also seen during this phase. Mainly the patient can experience seizure episodes, and also even Guillain-Barré syndrome and transverse myelitis has been seen in patients with dengue fever. Even though it is rare, we have to think in that terms also if the patient is having any neurological involvement. And even sinus bradycardia, as we all know, it is very common in dengue, and it can also lead to cardiac arrhythmias also. Ocular involvement can also be seen in the critical phase of dengue, mainly retinal hemorrhages, retinal edema, and optic neuritis. And even renal failure can happen in dengue fever because of extreme vascular leakage leading to hypotension, and rhabdomyolysis also, whereas injury to the muscles. So these are the main features of the critical phase of dengue. And in recovery phase, the patient's symptoms, as we discussed, what and all we have discussed, will improve. The patient will be able to eat orally, vomiting will subside, abdominal pain will resolve, fever will subside. So this recovery phase will last for 1 to 2 weeks of infection. So within 1 to 2 weeks of infection, recovery phase usually starts. So these all phases will be elicited only if we ask about all the symptoms to the patient. So that's why I've just discussed all these features in today's session. Briefly about investigations, only important investigations that we have to do in a patient with dengue is mainly CBC, where we are looking for leukopenia and thrombocytopenia, that is reduction in WBC count and reduction in platelet count, and elevated APTT, so the patient will be having coagulopathy in that case. And even if you do liver function test, the patient's AST, ALT, that is aspartate transaminase and alanine transaminase, will be deranged, like aspartate transaminase will be more than alanine transaminase. So that is one of the factors which will help us to diagnose dengue, even if it is serologically negative. The bilirubin will be normal, but AST will be more than ALT. And because of the plasma leakage, vascular leak happening in the patient, the albumin level will be also reduced in the patient. And serum ferritin is one of the factors that has been recently detected, which denotes the patient is will progress to a severe dengue or not. So when the patient is diagnosed with dengue, we do on day of admission serum ferritin, so as to see whether the patient's ferritin is elevated. As we all know, it's an acute phase reactant. So if it is elevated, we will have an idea whether the patient will progress to a severe dengue or not. So serum ferritin is also important investigation. But the diagnostic investigations are these, like dengue NS1 antigen and dengue RT-PCR, since it's an RNA virus. So these tests has to be done only if the patient comes within 5 days of illness. So beyond 5 days of illness, these will not yield you anything. So these are important within 5 days if the patient presents to you within 5 days. And if it is more than 5 days, till 3 months, they can get a positive IgM antibody, dengue IgM antibody. And even dengue IgG antibodies are seen in patients who are previously infected, which will persist for their life. So antibodies are important once the patient crosses beyond 5 days, and IgM during the acute phase, and chronic it is IgG. As basically all we know that dengue doesn't have a specific treatment. Main treatment modality is replenishing the intravascular volume through fluid supplementation, and even administration of steroids are also being considered in daily clinical practice. So if the patient is clinically stable, doesn't have much features of severe dengue, like the patient doesn't have any warning signs, then the patient can be treated even home-based therapy. Mainly if we send the patient home, the thing that we have to communicate with the patient is, patient has to be properly taking a rest, patient has to look after himself for any warning signs, as we discussed just before. And if the patient is having high-grade continuous fever, we have to give antipyretics for the patient. And also main important thing is, as I told, is fluid. So patient has to take more amount of fluids as he used to take, more than that as he used to take, mainly in the form of maybe ORS or any fruit juices or coconut water. All these can replenish the electrolytes in the patient and also can maintain the intravascular volume and blood pressure. So because I already told you, because the vascular leakage happens, the patients can develop dehydration, hypotension and shock. So rehydration, fluid replenishment is very important in dengue management. So what if the patient develops warning signs? So if the patient develops warning signs, they have to get admitted in hospital. So if the patient is having giddiness, if the patient is having cruel extremities, that is shock, if the patient is having oliguria, reduced urine output with dark urine, that is because of again oliguria, and bleeding from any site or persistent vomiting, or the patient is having lethargy or restlessness. So all these features can again put towards the warning signs. If the patient develops, patient has to be obviously get admitted in a hospital. So if that patient who was sent home developed warning signs, came back to our hospital, usually to a casualty in emergency basis, what should we do? So in those patients, you have to immediately maintain an IV access, usually through a wide bore cannula, and you have to immediately collect blood for HB, PCV and platelets, because through that we will get an idea whether the patient is having hemoconcentration or hemodilution. So based on that, we can again we can decide on management of fluid in that patient. And what should be monitored is pulse volume, blood pressure, abdominal girth. That is mainly if the patient is having ascites. So abdominal girth has to be monitored, and also urine output to see for shock. Okay, if the patient is having renal failure or not. So urine output has to be monitored. These are the important parameters that has to be monitored if the patient get admitted in a hospital with shock, with warning signs. So I already told you fluid is the main modality of treatment in dengue management, but there is always a confusion regarding what fluid to be given. So it is between crystalloids and colloids. So if crystalloids mainly NS and RL, and colloids mainly dextran, albumin and gelatin polymer. So always it is better to give crystalloids, because colloids will have an allergic response and the patient may land in further trouble. So always you choose crystalloids over colloids, and crystalloids we have NS and RL. So in that, which is better is NS, because RL, as we all know, contain lactate. So already the patient will be having warning signs, that is hypotension and shock. So already the patient will have accumulation of lactate in the body. So if we further give lactate, again the lactic acidosis risk is more, and this preferred is NS. But if we give further a large volume of NS, the patient will have hyperchloremic acidosis. So again in that case we have to switch back to RL, ringer lactate. Okay. This is a small flow chart showing severe dengue management with compensated shock. Compensated shock is nothing but the patient is having, patient is in shock but doesn't have any involvement of organs, no end organ damage. So the body's own mechanism is maintaining that. So if you just have a close look on this, patient with compensated shock will have to be given IV fluids at a rate of 10 to 20 ml per kg, preferably crystalloid as we discussed, over a period of 1 hour. So if the patient after administering this crystalloid improves, then we have to reduce the administration of crystalloid. The dosage has to be reduced from 10 to 20 ml per kg to 6 ml per kg per for 2 to 4 hours. So the dose of the fluid has to be reduced and duration has to be increased. And if the further improvement is noted, then again the dose has to be reduced to 3 to 1.5 ml per kg per hour, again for 2 to 4 hours. And after that, further shock assessment has to be done and hematocrit has to be evaluated. And if there is any further improvement, the patient can be discontinued from fluid therapy after 24 to 48 hours of improvement. So that is the magic that the fluid can do if the patient is improving. But if the patient is not improving in case of vasogenic shock, what to do? We have to check the hematocrit of the patient. Hematocrit will give the idea whether the patient's blood is getting concentrated or getting diluted. Way we can reduce the dose of fluid, and if the patient is improving with that response is there, then we can stop the fluid supplementation after 24 to 48 hours. So what if the hematocrit is not improving? If it is falling, we have to suspect again intracranial or internal bleeding of the patient. We have to supplement the fluid, blood products, whole blood at 10 ml per kg and PR packed red blood cell or 5 ml per kg dose. And if it is not improving with that, again we have to start on inotropes with the crystalloid support. So that part is same for all patients and all conditions of dengue. So that is what I said. It is all just brushing up what we have already know in dengue management. Just a short session today. So mainly today's session is on vector control or preventive aspect of dengue. So as I already told you, the vector here is mosquito, that is Aedes aegypti mosquito. So mainly this vector control is an integrated approach, that is integrated vector management, mainly which include biological, chemical and environmental factors. So biological factors, as we know, it is Bacillus thuringiensis israelensis, which is a bacilli which is used for engulfing or removing the mosquito in the larval stage from the water. So along with that, we can also use larvivorous fish also, which will engulf again the larval forms of these mosquitoes in water. If we cultivate them in water, they can reduce the risk of dengue in that endemic area, because they will have or ingest all these larval forms of Aedes aegypti mosquito. And chemical methods mainly include insecticides and environmental factors, mainly to reduce the breeding size. So as we all know, the mosquitoes breeds mainly in stagnant water. In case of dengue virus, dengue mosquito, Aedes mosquito, it breeds on stagnant fresh water, not contaminated water. So I think you might have seen at least one scene in your life, either a flower pot where the water is getting stagnant, which is kept outside the home, or in a roof gutter in old buildings, or in a waste bin, or in the vessel. So all this are storage or the stagnant forms of fresh water which has to be cleared, so that the breeding of this mosquito or the vector can be avoided. So which will enhance further, reduce the risk of developing in dengue, especially in an endemic zone. So after doing the environmental factors or environmental methods to reduce the infection, we can think of individual factors or individual methods that will reduce the infection getting into all the persons in the endemic zone, mainly using mosquito repellents, that is either a cream or a coil, or using a full sleeve shirts or a binion, whatever it is, and full pants, not shorts or 3/4, it has to be full pants, and bed nets. If you are using nets or the bed, it will be better. So all endemic zone people, if they follow this, they can somehow avoid or reduce getting infected with dengue.